Welcome to this week's interview with Meg Kilcup, a conventional pharmacist turned integrative, a mother of three, and a seeker of root cause. I'm Dr. Ben Lynch, and this is the Dirty Genes Podcast. You may have inherited some dirty genes. You may have inherited genes that predispose you to low mood. You may have inherited genes that predispose you to poor circulation and cardiovascular problems. You may have inherited genes that make you Superwoman or Superman. But regardless of what genes you've inherited, your choices, your actions, your everyday decisions determine how clean or dirty your genes actually are. So in this upcoming interview with Meg Kilcup, you're going to learn that genetics are definitely something that you should know about. They are not the thing that determines your outcome. Now, Meg is by training a pharmacist, and she worked in the pharmacy field for 10 years until she got out after seeing the corruption, the lack of safety, and the complete disregard of actually caring, why is my patient truly sick, and giving medication that leads to another medication because of the side effect, which then leads to another medication because of that medication side effect, which then leads to being stuck in the system for years, all based upon, well, the system instead of the individual. So I'm excited to share with you this interview because as a pharmacist, she lays out some scary facts that I had no idea were so out there. And Meg was fortunate enough to have 3 amazing pregnancies and having 3 beautiful boys at home, all under 10. So she's a busy lady. So I thank her for being available for this interview to share her insights as a doctorate in pharmacy and her expertise in the safety and the dangers of prescription medications and non-prescription medications, and trying to make a dent in an otherwise messed up field of sick care versus healthcare. So enjoy this episode. So Meg, of all things in the healthcare industry to choose from, you got nutrition, you have counseling, you have surgeons and doctors and RNs and RAs. Why did you choose to become a pharmacist?
You know, looking back to my likely immature 18-year-old self, really for me, I knew at that age, I was like, oh, I want to be in healthcare. I want to help people. But I was really squeamish with like blood and guts. And as much as I wanted to be a doctor, I didn't want to be a doctor. And I think, honestly, through a pretty immature process of elimination, I landed on pharmacy. You know, like I'm sure my counselor was like, hey, you're really good at chemistry. This is a great job security, you know, like, et cetera, et cetera. And one thing led to another. And then I got into a really great pharmacy school at the University of Washington. And that became my destiny, right? Looking back, if I really knew myself and knew my interests, I don't think I would have signed up for that.
It's awesome that, you chose a field based upon your skill sets and you pursued it and you went after it, you did it. And then at the same time, you listened to your gut and say, you know what, I need to get out and do something different.
Yeah.
And you did that. You listened to your heart because it's tough to shift.
Absolutely. Yeah. And it's tough, especially when you really want to make a difference in it. You know, I'm like, wow, I'm in the perfect place. I'm in this system. Like, what can I do, right? Like, how can I help this? But then at a certain point, you realize you're like operating in a box. So
if you were to boil it down to all the working pieces, what is a healthcare system, which isn't a healthcare system, it's a sick care system. What is a sick care system catering to?
I remember sitting in a room with a bunch of emergency room physicians, and they were just like, look, we got to turn over the beds and we got to keep the patients happy. And the way we do that is by giving them what they want. And so I just remember sitting there, and they knew that wasn't the right thing for the patient. And after hearing these conversations time and time again, I'm just thinking, we have not set this up correctly. And it's exactly like you're saying. The incentive isn't necessarily to heal a patient. It's It's to do what they need to do for the business model. And I'm not saying that the providers in and of themselves are bad people. They're just operating in this very broken system.
Yeah, and I've had patients in the past where, they wanted a medication, say a steroid, to suppress their immune system so they could eat the allergens, which were causing significant pain in their joints. But we identified it was egg whites that was causing the pain in the joints.
Right.
So we removed the egg whites from their life, and all the pain in the joints went away. Their life returned back to quote unquote normal, even better than normal. Right. She came back a year or two later, and I was like, I was excited to see her. And she goes, hey, I actually want to be put on the steroid because it's too hard to eliminate egg whites in my life. And I said, do you realize the significant side effects from steroids?
Right.
Said, yes. I said, no, let me sit down and go over it.
Yeah, it's really too bad. I think that was the other piece is that, there's not any focus on root cause assessment or healing or labs to identify that. Nor is there the time to even dig into it. It's like 15 minutes. It's like, hey, how are you doing? What's your symptom? All right. Write it down, diagnosis, right? And so I think I was just talking to a friend a week ago. We were out hiking and she's like struggling with something and the doctor prescribed her steroids. And she's like, I'm not taking steroids. I'm going to figure this out. I'm going to change my diet. And, I think that's the way it should be. And you shouldn't have to persuade your doctor out of a prescription because you want to actually heal.
Yeah, I will do the opposite. Because patients don't know. You watch the TV and you see the floating butterflies and happy-go-lucky people.
Right.
And, you want that. And it's like, oh, I just have to swallow that particular pill and go for it. I had a patient who came into the clinic and she was a school teacher and she had just horrible sinus congestion and it was just terrible. And so she didn't want Sudafed or, any of those types of things. She wanted something natural. So we did the neti pot. We did some herbs and all that. She came back 2 weeks later. She goes, still the same. So dove in a little bit deeper. And I was like, well, she was doing some remodeling on her home. All right. So are you done? Yeah, remodeling's done. Well, keep doing the neti pot, keep doing the herbs and maybe avoid gluten and dairy for 2 weeks. Came back a few weeks later, avoiding gluten and dairy, still bad. I'm thinking about resorting to drugs, because this just isn't working. And I was like, well, we evaluated your home, but we haven't evaluated your workplace yet. She goes, well, I work in a public school. Well, I think you need to call an environmental inspector into the school and check it out. And she was like, oh, that sounds kind of tough. I said, no, you just call an inspector. And I was surprised. She came back, I think a month or so later, and she told me, she goes, well, I have good news and bad news. I said, well, give me the good news first. She goes, my sinuses are clear. I said, cool. What'd you take? What are you doing? She goes, I'm not taking anything. Inspector came over to the school and they investigated it and they found mold in all the heating and cooling duct systems. And they evacuated the school and they destroyed it.
Oh my gosh.
So that is a true story.
That's amazing though, right? I mean, wow, you impacted not just her health, but hundreds of people who were living in a toxic environment.
And so when you talk about root cause, that took multiple visits and that took some sleuthing and it took some dedication from the person who was struggling.
Right.
They could have taken Sudafed. They could have taken something over the counter and turned the mucus into concrete in their nose. But they chose not to. So I give her a lot of kudos for that.
Man, how can we keep patients from not needing all these evidence-based recommendations on these 1, 2, 3, 4th, 5th line treatments? How can we just actually get them well with lifestyle? Because we know once we get on these drugs, there will be side effects and there will be ramifications down the road.
Part of the model is to utilize,
customers.
If prescription A causes headaches, then prescription B can relieve headaches. And if prescription B, part of the headache, cure causes constipation, well, then they'll give something else, right?
Oh, absolutely. And I think that then you have this patient that's constantly then needing you or more drugs and not actually feeling any better, right? And you look at patients once they're 50, 60, 70, I was, reconciling medication lists at the beginning of my career. These patients end up on like 20 medications. And can you imagine the impact on our body, like much less, 3 to 5, 20. And that was the norm. Like
So the
you're
norm
saying.
was around 20?
Oh gosh, we actually did a published article or study in JAPHA, and I want to say it was like 13
Wow.
up to 20 and more, but in the teens, so common.
What age groups?
Gosh, the ones that we were reconciling meds on were probably the older generations. I couldn't state exactly, but but even in the younger generations, this is happening too, right? So many people with autoimmune diseases, allergies, like so many things, and they get put on layers of drugs that are then impacting the systems of their body, their mental health, their gut. I mean, the drugs can impact our gut. So many drugs that are used all the time. And then our gut impacts our whole health, like in a giant way, which I know you know. But I never learned about that in pharmacy school. We never talked about that in hospitals and clinics with doctors, with patients.
And doctors don't know it either.
Like the word microbiome, I mean, that wasn't part of my language until I started researching on my own.
So what do you tell people who are really involved inside the system with their own health? They've been brought up that way with their parents. Something was wrong with them. They go to the doctor, they take a pill. Now they feel better, whether it was acne, whether it was headaches, whether it was migraines, lack of focus in school. Everything was a medication. And that's what they were used to. They had an earache, medication. Didn't always work, but that's what they got.
Right.
So now it's patterned, right? It's habit. So what do you tell someone who is stuck in that habit?
Well, I think it has to be a factor within their own self to decide, I'm either in this for my health or I'm not, right? So you can take all the pills, but like, how do you feel? Like you can still be very sick and be taking the 13 pills for your health, right? Like, what's your energy like? How's your mental health? How do you engage with, in your relationships? All these things, like what's your longevity look like?
They are so stuck in it that they don't actually realize that there's something better out there.
Right. And the thing with medications is, you might quiet that symptom and it's great. Like you can even do that with ibuprofen, right? With pain. So you can quiet a symptom, whatever it is, whether it's mood, pain, blood pressure, like whatever you're treating, but the problem is still there, right? And so as you're doing that with that drug is having likely an impact in so many other areas of the body, and that can be so damaging. It can be so harmful, and it can literally take the life of some people.
Was there any life experiences when you took a medication and it transformed your life?
Yeah, so kind of in my mid-20s is when I was in pharmacy school. So getting a bunch of vaccinations for just to even be in pharmacy school and like enter these hospitals and provide care. And then on top of that, I traveled to Africa, Nicaragua, Costa Rica to do some, kind of like medical sustainable missions work, I guess you could say. So anyways, I had to get kind of like an onslaught of vaccinations. And that was right around the same time in my life that I developed an autoimmune disease called Raynaud's, or not sure actually how you say it perfectly, but yeah.
That's
so that's,
me.
and at that point I was in the mindset of like, well, if they recommended it, must be what I need, right? Like that was my training. This is what the CDC says, this is what you do. And so I got it, and kind of right around that time when I got all those is when I developed the condition where like my hands, like my fingers, I would even be like in the grocery store in the frozen section and my fingers would kind of turn yellow and numb. When I would be outside in the cold, my fingers and toes would kind of just change colors. Like my fingernails, like it'd just be super tingly and honestly painful. And it did impact my life, especially in the winter in a big way.
So you've improved your health immensely. And how significant is Raynaud's a problem in your life currently?
Yeah, that experience for me was pretty eye-opening, to be honest, because of, what it coincided with, as well as I went to the doctor and I'm like, hey, this is going on. And they were like, yeah, this just like happens. And I was like, but why? Like I've never, experienced this. And they were like, well, you can take some drugs. She recommended actually Viagra.
Right.
So I was like, I understood the mechanism why that would help. And I was just like, no, thanks. As well as beta blockers, which I already have incredibly low blood pressure. So I was like, I'm probably going to pass out if you put me on a beta blocker. So I just gave them all the reasons why I was adamantly against their recommendations for me. But and like in those doctor's visits, we never talked about like why or how I could maybe heal. It was all just like, well, you can take these drugs, Viagra. I'm like, all of this was starting to make sense in my head. It was just like what my whole career had shown me, right? And I decided over time, like, I'm going to take this into my own hands and just try to heal and make lifestyle changes. I focused on gut health. I eliminated for a large chunk of time gluten, dairy, lowered my caffeine intake, lowered my even like chocolate intake, all the things. I'm like, anything that I can do to see if my symptoms can improve. And even, like now I can go snow skiing all day and barely have any symptoms. And so I wouldn't say I'm fully healed, but all the steps I have taken to minimize toxins, maximize nourishment, and do all these incremental sustainable changes, it's like I actually am just better.
So then you are more likely to make lifestyle decisions which are supportive of you rather than hindering of you.
Sure. Well, it's interesting because I think when I look back on my life, like I do have this Raynaud's, but it did hit me kind of like at a key point in my life. But what I definitely can say that how I feel today is different than how I felt 5 years ago and how I felt 10 years ago when I really wasn't taking care of myself in the same way I am today. So I can tell if I'm eating well, exercising, taking care of my mental health, taking time to be in relationship with my community, all of those things. I feel great, but if I'm in a season where some of those are going underwater, I just don't feel great, right? Like if you're not eating well, if you don't align with your job and that adds stress, I had that in my life, right? Like I didn't align with my job at a certain point and that adds stress and you just don't feel like yourself. And I think that's something that I'm always trying to tell people is like the way we treat our bodies will literally impact like if you're thriving or if you're just living in a way that where you're just like getting through the day. And people like you I love it. Like you say, like genes load the gun, but lifestyle pulls the trigger.
Yeah. And so kudos to you for making that shift. And so, and you listening, if you have dirty genes and you're struggling and you are in a job or in a position somewhere, or you're in a relationship that is just not suitable to you, you really sit down and evaluate and talk it through with someone, because it might be time for you to make a significant change. And if you're living in an area, maybe you're living in a country and you want to go back to the city because you love the city, or maybe you're in the city and you want to get the hell out of there and you want to go to the country.
Yeah.
You got to do what's right for you, because as far as I know, we live once.
That's great advice. I second that.
So anything else you want to wrap up with, Meg, and share with the listeners that we haven't touched on that you believe is very, very significant for you?
Well, you just touched on one thing. And for me, I think that really is just to follow your gut and follow, it got to the point, whether it's your health that's telling you something or, your job, like you're saying, your relationship. But I got to the point where I was like, I either choose to live in this and, it essentially became toxic to my health because I couldn't stop thinking about it. So whether it's your lifestyle or your job or whatever it is, like we all have the power in ourselves to decide how we want to spend our days and how we want to feel and who we want to serve and the impact we can make on this world. And so I think for me, it was about, with how I'm serving others, it's huge. Like making that switch and stepping into empowering others to create their health has been huge. But also for our listeners, for them personally, like we all get to decide how we want to own our health. Like no doctor, no health system, no insurance company, no reimbursement models, probably going to change maybe, but like it's going to come down to you, right? And how you want to create your health, how you want to clean your genes. And I would just say to anyone who feels discouraged is that it doesn't happen overnight. Like for me, all these changes over the years, like, yes, I've been quote healthy and all that, but to feeling how I feel today didn't happen overnight. And living the life I live today didn't happen overnight. It's just like those small sustainable steps, those intentional choices that you make every day that create that wholly healthy life, like mentally, physically, emotionally, right? It's not like one day you just wake up and you like feel awesome. So, just take heart and like follow your gut and follow that intuition and whatever it's telling you, whether it's about life or your health, and then take those sustainable steps. Baby steps can make a big difference. And I always like to encourage people like that in that, because it's not like, these changes don't happen overnight usually.
No, they don't act in a straight line either.
No.
You're going to have moments where you're dragging yourself through the mud, and then you realize, okay, I'm tired of doing that, and you make an effort to not do that, and you're on your way to improving, and then somebody else pushes you back down in the mud, and you get all pissed off, and and then you pick yourself back up, and it happens again. So it's just being resilient. I remember reading a quote about an entrepreneur. An entrepreneur is someone who falls down 7 times and gets up 8.
Oh, that's so good.
We're going to fall down way more than 7 as humans.
And if you're never falling down, then that could be a problem too, right? You got to take these risks. I had to take lots of risks to get where I am today. I woke up today, I was like, I'm talking to Dr. Lynch. And a year ago, I was still in my job as a director of safety and quality, trying to figure out what the heck to do, And so you never know where that risk is going to take you in your life, whether it's your health or what. So
well said. Yeah. Sometimes pains are our biggest teachers, and failures are leads to our biggest successes. So yeah, I'm glad you brought that up. So, well, awesome having you here, Meg, and sharing with us the ins of the industry and the black part of it and the good part of it, and then how you're able to shift out of it and support your own health. And not only that, but support the health of others. So
yes.
I thank you for doing that. And people can find you on Instagram and your website at?
It's awholehealthlife.com, awholehealthlife.com, or at awholehealthlife on Instagram.
Awesome.